You are most welcome, ladies and gentlemen, to Real Impartation Moment on Tuesday Night Anatomy with Danny Lopan. Today's section, I take you through an important aspect, still regarding the region of the thorax. My friends, today mainly I want to talk about something about the heart. I will deal with some important aspects that we have to understand regarding, the heart chambers. Then I will also look at something we call the pericardial sinuses. Now, because pericardial sinuses are some kind of spaces, due to the reflections, of the pericardium, where these blood vessels, entering or leaving the heart, will be around over there. That is why for this class, I'll begin looking at some aspect of the pericardium first. Then I'll go to pericardial sinuses, and then from there, I'll look at some important features which are worth, appreciating as far as the chambers of the heart, is concerned. Of course, I won't leave you behind regarding the borders of the heart. Sometimes I see students cram some of these things. There's no need cramming them. Just a simple diagram will help bring out every concept that you need. So my friends, without much ado, let's set the ball rolling. Now, I wanted to begin with pericardial sinuses, straightforward, but it makes sense that we begin looking at some brief aspects, although I've done these videos already regarding the pericardium. So let's begin with, of course, this pericardium I am talking about. Now, my friends, whenever I talk about the word peri, means around, cardium, around the heart. Now this pericardium is a fibroserous membrane covering around the heart. Fibroserous. Now, what it tells me is that although, previously I've been teaching you that we have something called serous membranes, where, of course, for instance, I mentioned, last week I told you about one of the serous membranes by way of the pleura around the lung. Then we also talk about the intraperitoneal structures in the abdomen, having what we call, peritoneal covering. Now, my friends, this pericardium is very unique because it's not only having serous membrane, it also has a fibrous component, and that is why we say it's a fibroserous, membrane. Now, the first thing is that what it means is that this pericardium will have what we call a fibrous component, and it also have a serous component. That's the first thing I want you to know. Now, by way of this fibrous component, that will be the outermost, the most, external part of this pericardium is, of course, the fibrous pericardium. Now, the question that I want you to know, I want you to answer for me, because we've done some of these things in our general embryology, is that what is the embryonic origin of this fibrous pericardium? Yes, I want you to answer me. And I'm sure you got it right. That just like, because this fibrous pericardium is the outermost, what happens is that it blends with the central tendon of the diaphragm. Yes, it blends with it. And you know something about the central tendon of the diaphragm, that the diaphragm, its central tendon, will originate from something we call septum transversum. So the same way, this fibrous pericardium, its embryonic origin, and I want you to know that its embryonic origin, just by way of some simple revision, will be coming from something we call septum transversum. Septum transversum. And my friends, if I ask you what is this septum transversum, I'm sure you will tell me that this is the undifferentiated lateral plate mesoderm. We know that this lateral plate mesoderm, get differentiated with the help of intraembryonic coelom, getting us something we call somatopleuric lateral plate mesoderm, and of course, planktopleuric lateral plate mesoderm. Now, the cranialmost aspect of this, embryo, we don't have, the differentiation by way of the intraembryonic coeloms. That's why we say that area, there's no coelom over there, and we call that thing septum transversum. Undifferentiated lateral plate mesoderm. I want you to appreciate that is the origin, of the fibrous pericardium. And my friends, how about the origin of the serous pericardium by way of some simple revision? Serous pericardium. Now, whenever we talk about serous pericardium, one thing is that is where we come to our bilayered serous membranes again. Remember that last week I told you that for us at the pleura, we'll be having the visceral pleura, which will be intimately associated with the lung. So the same way, we will be having what we call visceral pericardium intimately. So we have what we call visceral pericardium. Let me put it this way. So we have it, let me come this way, visceral pericardium, visceral pericardium, okay? Then also have what we call the parietal, the wall in which this heart dwells, okay? Fusing with that of the fibrous pericardium, you are going to have the parietal layer of the serous pericardium we are talking about. And my friends, one thing you got to know, that whenever you talk about this, okay, so what will happen is that if you are having the serous pericardium, which is bilayered, parietal and visceral, then there's a potential space between them. And that potential space between the visceral and the parietal layers of the serous pericardium is something that we call, yes, of course, the pericardial cavity, which you have this small amount of this pericardial fluid running in there, minimizing friction and all that. Yes, so that is one thing I want you to know. This is going to be that visceral, the pericardial cavity. Yes, that's what is going to happen. Now, it therefore tells me that this serous pericardium has something to do with the lateral plate mesoderm. Because I told you that in the lateral plate mesoderm that there will be a coelom. Okay, so that coelom is the one, so for instance, the space captured between the visceral and parietal layers of the serous pericardium is what we are calling pericardial cavity. Pericardial cavity. Now, if it does the pericardial cavity, then that coelom, the intra-embryonic coelom, is the one which is going to give rise to this pericardial cavity. So if I ask you that what is the embryonic origin of this pericardial cavity, just like, pleural cavity, peritoneal cavity, it will be coming, okay, from what we call the intra-embryonic coelom. And my friends, one thing we know about this intra-embryonic coelom is that it is with the lateral plate mesoderm. And that is why you have the parietal component or the splanchnopleural component, and then of course the somatopleural component. And so this parietal, okay, will become parietal has to do with body wall, and that is why this one will be arising from what you call the somatopleural lateral plate mesoderm. And whenever we talk about lateral plate mesoderm, you know what we are talking about. Okay, so the same thing, if in the case of the visceral pericardium, it will be coming from what we call the splanchno. You know the word splanchnic has to do with lateral plate mesoderm. Or you know the word splanchnic has something to do with viscera, mainly internal organs derived from endoderm. Okay, that is one thing I want you to know about these things. Okay, so there's one thing about it. Now, what we are saying is that the heart initially begins as a tube. Okay, try to understand these things. The heart initially begins as a tube. Okay, initially there will be two cores, and those cores, okay, you know, we talk about core, there's no cavity in there, so there's no core. We have two cores, which we call them cardiogenic cores. Okay, in the cardiogenic area, and later there will be cavities developing in there, so that we talk about endocardial tubes, which will fuse eventually, and then of course fold, giving us this heart we have. Now, the point I'm trying to make over here is that because it's a tube, what will happen is that we have the cranial end being the arterial end, and then we have the caudal end being of course the venous end. During the folding of this tube, okay, assuming this is the arterial end, we have the this portion to be the venous end at the caudal region. They will fold, and then eventually what happens is that the arterial end and the caudal end, they come close, okay, at a portion. That's what I'm talking about, the basis for these pericardial sinuses that I'm going to tell you. Okay, so let's explain that one to you. And one thing that you have to know about this diagram, also this, schematic representation that I showed over here, is that whenever we talk about epicardium is made up of this visceral pericardium together with something called a pericardial fat, epicardial fat actually. okay, together will form this pericardium that we're talking about. Sorry, epicardium. Epicardium. When we say epicardium, sometimes in your exam you may not see epicardial fat, but you see the visceral pericardium. Yes, take that one. But right now we are looking at the pericardial sinuses. Briefly, pericardial sinuses. In fact, that's the one I wanted to begin with. Pericardial sinuses. Very important. Now, mainly we have two kinds of pericardial sinuses. Due to, of course, the folding of these vessels, okay, there will be that kind of pericardial reflections around these vessels, entering or leaving the heart. Okay, so we have those spaces around, captured around. And these spaces are of immense importance. And that's what I want to review over here. Now, trying to just schematically show you something about the heart. Let's try and draw this. Okay, so draw it as I'm drawing it. Okay, now let's take it that this is our heart, okay? And so if this is the case, one thing that I'm going to show you is that now let's take it that I have the aorta, okay? So as I told you about it, the tube, okay, it's like this. So they will come up to a certain point, okay? So what I have over here is that I see this. This my ascending aorta, okay. Then I also have my pulmonary trunk over here. Ascending aorta and my pulmonary trunk here, okay. Now that becomes, now remember that the ascending aorta and pulmonary trunk will come from the cranialmost portion of the heart tube. Now remember that if I divide the heart tube into three, okay, I'll have what we call from the arterial end, I'm going to have what we call the bulbous cordis. Then I'll go to what we call the primitive ventricle. I'll go to primitive atrium. Then I'll go to, of course, the sinus venosus, okay, the venous end. Now, what I'm trying to say is that the cranialmost portion, if I talk about the bulbous cordis, the cranialmost portion is also divided into three. The third portion, the cranialmost portion, is something called truncus arteriosus. I've done all these videos, okay. If I go to my playlist regarding developmental anatomy, you get all these videos there. Now, so this becomes the arterial end. So I'm going to call this, now, over there, the pericardium is all around the heart. So what will happen is that because of these green vessels, they will also be covered in this manner. Okay. So this one, okay, together, this is what I have. Let me call this arterial tube. Arterial tube or arterial end of the heart tube. Okay, so that's the first thing. Now, the next thing I want you to know is that, yes, I also have some great vessels, okay, by way of, for instance, let's say superior vena cava will be somewhere here. Let me say that. Let's say inferior vena cava will be somewhere here. Let me put it this way. Okay. Then also, yes, at the posterior aspect of the heart, the posterior most portion of the heart, okay, draining the blood. Okay, that blood which has been oxygenated, actually bringing it, okay, draining it from, of course, the lung into, of course, what we call the left atrium. Okay, at the posteriormost portion, I'm going to have this. I'm going to see 4 veins over there. So let me say there's one over here. There is another one over here for, let's say, the superior. Then we have those ones below over here, which will be the inferior pulmonary veins. Now remember that there are 4 of them. Okay. Now for this reason, what is going to happen is that, now let me make some change over here. Although this one, pulmonary trunk, you know the blood, it will be carrying oxygen poor blood. Let me use blue to show this one. So this one over here is my aorta, but precisely I'm talking about the ascending aorta. And then this one in blue because we carry oxygen poor blood becomes the pulmonary trunk. Okay, forming that, arterial tube. So that the remaining over here, these are all veins. Okay, this one I have over here is my superior vena cava. Superior vena cava. Yes, likewise, I'll have the inferior vena cava. Okay, then these become the four pulmonary veins draining into what we call the left atrium of the heart. Okay, now what is going to happen is that now pulmonary veins, they'll be carrying oxygen-rich blood. Let me use red to show that. So to that effect, I'm going to use red to show. Let me use red to show that. But they'll be carrying oxygen-rich blood. Okay, let's use red to show that. Now, the same pericardial reflections, yes, should be moving around these ones. The same pericardial reflections. So for instance, let me see, I begin from here. Now it's to all the veins, so we move all around it. Let me send this one here. Okay, so these are the pericardial reflections around the vessels, okay, which are either draining blood into the heart or taking it away. Now what happens is that, because I told you we have the arterial end at one end, venous end, okay, fold that at a point, then what happens is that there's going to be a space. Because of the pericardial reflections, there's going to be a space between them. So for instance, now over here, these are the pulmonary veins. Let me put that one down. These over here represent what we call the pulmonary veins. Okay, together everything. Let me see, pulmonary veins. Together with the vena cava, the pericardial reflections, together all these veins over here will form something called the venous end of the heart tube. Now let me put it over here like this, that everything that I've done over here up to this point will be the venous end or the venous tube, okay, of the heart. Now let's now think about it. The first thing, the space that is captured over here, okay, the space over here, okay, let me make it this way. The space between the arterial end, okay, and then the venous end, the space, because of the pericardial reflections over here, the space captured over here is running in a transverse manner. So that is why this sinus will be called transverse pericardial sinus. So my friends, this sinus that we find over here, let me call it sinus number 1, okay, will be called transverse pericardial sinus. Okay, if I should put it over here, the number 1 here is transverse pericardial, okay, sinus. Now don't just say transverse sinus, because transverse sinus is one of the durovenous sinuses, okay, in the head region. Now we are not talking about that. That's why you have to qualify with pericardial sinus. Okay, now remember that this transverse pericardial sinus running transversely over there, it means that in front, okay, of it, I'm going to have what we call this vena cava, and behind it I'll have these arteries. Yes. So by way of especially the superior vena cava, so for instance, I can, if I put my finger or a probe, okay, through the sinus, then in front I will see what we call the superior vena cava over there, and behind I will see these vessels. Okay, and these are great vessels. They are very large vessels over there of the heart. And whenever cardiac surgeries are indicated, there could be a lot of loss of blood. So what's going to happen is, because these are, I will say that this one can bring blood in here, this one can take blood out of the heart. So we want to clamp it. We want to ligate, okay, these great vessels during cardiac surgeries. So one thing I want you to know is that whenever you talk about this transverse pericardial sinus, it has surgical merits. We are going to use it to locate, okay, these great vessels so that we can isolate them. Once we isolate them, then we clamp or we ligate them so that cardiac surgeries can go on smoothly without, that kind of eventful issues like losing a lot of blood. Okay, I want you to know that. Now, in the case of this under sinus, okay, and I'll call that sinus space number 2 over here. Especially now, the pericardial reflections, especially related, these are the lower pulmonary veins. Then we have the superior pulmonary veins over here, especially over here, okay, related to the lower. So once you come over here, this region, there's under sinus. Now remember, I said that these veins, pulmonary veins, they are opening into what we call the left atrium of the heart. Remember, now the left atrium of the heart is the most posterior component of the heart. Yes, the most posterior component of the heart. So whenever you are looking for this number 2 sinus, which you call it oblique sinus, so number 2 is called oblique pericardial sinus. The number 2 oblique pericardial sinus. Now, my friends, that one, we're looking at it at the posterior most portion of the heart, where we have what we call the left atrium. Over there. Okay? Now, over there, what we see is that this one is a cul-de-sac. Okay? Now, it's a space over there, which we can call it cul-de-sac. Yes? Or it provides something we call additional dead space. Now, remember something. Whenever I say additional, it means there's something there already, and we are adding on. Now, what is there already? The left atrium, just like the right atrium, will be having ear-like appendages, which we call them auricles. So what happens is that there's some kind of dead space over there, so that when there's increased venous return, then what do I mean by increased venous return? Increased venous return in the sense that from the lung, the oxygenated blood will be coming into the heart through, of course, these pulmonary veins, actually into the left atrium. So when there's increased more of these oxygenated blood coming from, of course, the lung, that is when I'm talking about increased venous return. Now, I'm not trying to say that we are bringing the oxygenated blood, we are bringing oxygen-rich blood, but we are talking about pulmonary veins. So it's a reverse, right? So we're coming with oxygen-rich blood. When there's increased venous return, bringing this oxygenated blood from the lung, then what is going to happen is that we will need additional space. Apart from, of course, the left auricle also increasing it, but we need additional space. Now, why is it that we need additional dead space? Why did God do that? Now, in the case of the right atrium, God didn't put any additional dead space over there. Yes, what's the reason? In the case of the right atrium, it is larger. The chamber is larger compared to that of the left atrium. That's number 1. Number 2, the auricle of the right atrium is larger than that of the left. So because that of the left is smaller and the chamber is also small, then we have to provide. Okay, God needed to do that, and that is why He put something over there, behind over there, okay, providing additional dead space which can be filled. And why is it so? Also, another reason is that related to the posterior aspect of this left atrium as a chamber, we don't only find these pulmonary veins over there, we also have what we call the descending thoracic aorta also there. And apart from that, we also have some portion of the thoracic part of the esophagus. So the esophagus will also be running behind this, left atrium. So that if there's no additional dead space and it becomes, excessively filled because of increased venous return, then what is going to happen? It's going to compress against this esophagus and likely dysphagia may result. Difficulty in swallowing. You understand what I'm trying to say? Momentarily. Okay, so that is what I want you to become aware. And that is why we have this additional dead space. So it means that this oblique pericardial sinus is providing additional dead space as a cul-de-sac, ensuring that the left atrium can expand to accommodate increased venous return. It's as simple as that. And so it means that this oblique pericardial sinus, unlike the transverse pericardial sinus, which has surgical merit, this one has natural merit. Yes, no surgical things over here. And so I want you to appreciate that. Yes, so this is what I want you to know regarding the pericardial sinuses. 1 point. Now we move on to another important thing. Now there's going to be a rapid section. I want to quickly tell you some important things. Good. So once I'm done with the pericardial sinuses, one thing also that I see students cramming, okay, is when we talk about something we call borders of the heart. So I want to also use some kind of diagram to explain the borders of the heart to you. Borders of the heart. And quickly we go to the chamber. Borders of the heart. Borders of the heart. Okay, so I want to put that one down. Now let's try and sketch this one. Okay, so that discussion becomes very easy for us. Okay, now let's take it out. This is the heart. Okay, now if this is the heart, if you are looking at it from an anterior view, okay, let's say we are looking at its anterolateral view, okay, that's what we want to see. Then this is something that we are going to see. Okay, we are going to see something like this. Now, mainly I'm seeing three main chambers, okay, externally of the heart. I don't see the fourth chamber, and the fourth chamber is actually the left atrium. I told you that left atrium is the most posterior component, so usually we are not going to see that one. Now, let's move on. Now, the first thing is for us to look at what we call the right border of the heart. Right border. Okay, before I even write this, let me orient you. This one that you find over here is the right atrium. Right atrium of the heart. Because how do I know it's the right atrium? Now, whenever you see these great vessels, okay, draining blood in there to the right, either you know it's the right atrium. Because this guy over here in blue is actually the superior vena cava. Superior vena cava. And then the one below over here is nothing but, of course, the inferior vena cava. They drain blood, venous blood, into, of course, this right atrium. That's why I've indicated them with blue. That's what we see. Now the next thing is that this one that you find over here the one here, this is nothing but what you call the right ventricle. The right ventricle. Okay, in line, down there, in line with where the inferior vena cava down. Okay, right ventricle. And then also, you also have that of this one over here is actually the left ventricle. I know that one so well because you can see that it is becoming narrow at this point. That's the apex. The apex is contributed by the left ventricle. Okay, now the one I've put over here is actually to the posterior aspect where you see some portion over here. It's actually the left auricle. Left auricle, just a small portion over here. But we don't see the main chamber by way of the right. By way of the left atrium. The auricle, the appendage is the one we find over there. And the first thing, what is the right border of the heart? The right border of the heart is contributed by what? I want you to tell me the right border of the heart. So this is the right side. And so this, whenever we say that what contributes to the right border of the heart, your answer is this, is the right atrium. Right border gives rise to what we call the right border of the heart. And it forms the right border of the heart. Okay, to this side. Right border of the heart. Okay, and remember that whenever we say right border, you can see it's, more or less vertical. Okay, so we say that the right border of the heart is vertical, and that is why, I've said it times without number that there's this nerve by way of the phrenic nerve, which also gives supply to the fibrous pericardium, sensory supply to fibrous pericardium, eventually going to give motor supply to the diaphragm. Okay, running in that pericardium, okay, because it's very close over here, then we say that the right border of the heart, because it's vertical, then we are saying the right phrenic nerve is shorter than that of the left. For the left, we have to run all the way this way, oblique border of the left border of the heart, the left border of the heart. So it becomes longer than this one, the basis. And also that's the reason why that I've told you, when I told you about the major openings in the diaphragm, we said that the ventricle opening, okay, doesn't go alone. It also comes with the right phrenic nerve. Because the right phrenic nerve also runs over here. The basis for some of these things, you don't need to cram them. Okay, now, if I've seen the right border of the heart, then there's sometimes this question which people find it difficult to answer. The right cardiac shadow. Right cardiac shadow. If I say that what is the right cardiac shadow, then my friends, of course, this right atrium also contributes, but that's not all. It will also include this superior vena cava and of course the inferior vena cava. So this guy over here, okay, this right atrium itself, and then of course this inferior vena cava, together these three will form something we call right cardiac shadow. Yes, because you can see that all of them, all these three, they are to the right side. Yes. Now the next thing is that if you've seen the right border of the heart, let's go, okay, in this manner. So what manner is this? We are going in that kind of, clockwise manner. Okay, let's go in a clockwise manner. Now, how about the inferior border? From the right border, we go to the inferior border of the heart, the inferior, the lower portion. Inferior border of the heart contributed by what? Of course, you will tell me that over here we still have the right atrium. Then we have what we call the right ventricle. Yeah, together with, of course, the left ventricle. But of course, majority of the contribution will become, of course, the right ventricle. Okay, of course, that of the right atrium. Little contribution from what we call the left ventricle. I want you to know that. Now, if I move out from there, then I go to what we call the oblique border. So this is the inferior border. So the inferior border, there are three things I want you to know. 1, 2, and 3. And what are the 1, 2, and 3? Inferior border. Okay, the inferior border. Okay, there are three of them. These three things I want you to know. Right atrium, right ventricle, left ventricle. Yes. Now, how about the left border? The left border, yes, mainly is by, of course, the left ventricle itself. Left border. of course, is formed by, of course, this, left ventricle. Left ventricle, together with, of course, this portion, okay, which we have on the left auricle, will also contribute to this left border. It's as simple as that. Okay, good. Now, if I've seen the left border, now how about the apex? Already I've told you the apex. Okay, this portion over here, the apex. And so the apex is also, yes, this left ventricle also forms the apex. It's formed only and only by, of course, the left ventricle, the apex. If I've seen the apex, then there should be a base. Now the bases are the posterior aspects. I want you to know that. And they are what you call the atria. Mainly what? Which one do you think you will tell me? The base. The base. The base of the heart. Mainly you will tell me that we are talking about what you call the left atrium. Because already I've consistently told you that the posterior most portion, okay, is the left atrium, contributing about 2/3 portion to the base, and then the remaining 1/3 will be by what we call the right atrium. Little contribution from the right atrium. Okay, I want you to know about these things. Okay, so that's the borders of the heart. Not so much. Okay, this is something that we have to understand. Now, the final thing we are going to do is very important. Just to go inside this chamber of the heart and review what happens. Yes, mainly I'll talk about the right atrium and of course the right ventricle. They have a lot of features for us to appreciate. Good. So the chambers of the heart, the one that is very important, I want you to know that the pericardial viewpoint, so that in the gross anatomy lab, for instance, you'll be able to identify important structures. And so I'm interested in telling you about the right atrium. Now the first thing, before I even move on and draw something, whenever we talk about the atrium, whether we are talking about the left atrium or the right atrium, the first thing we have to know is that we have what we call the rough part and then the smooth part. I want you to know that. From the embryonic viewpoint, because of that, we have some portion which will be rough and another portion which will be smooth. Now, the ones which are rough will be coming from something called primitive atrium. In the heart tube, development of the heart, I've done these things. Primitive atrium. So whether it's the rough part of what we call the right ventricle or the rough part of the left ventricle will be coming from what we call primitive atrium. Now how about the smooth part? Yes, the smooth part for that of the right atrium, it will be coming from something we call the body of sinus venosus. The body, I'm interested in telling you is the body because we have the other areas, okay, the leg-like processes or the horns. I'm not talking about those ones. The body of what you call the sinus venosus. Yes. But in the case of that of the left, the smooth part will be coming from what we call absorption of the four pulmonary veins. Now remember, veins, vessels, they have some smooth parts, okay, so they'll be absorbed, okay, to form the smooth posterior portion of what we call the left atrium. Now remember, I've mentioned it already, but let me tell you. The rough portions, they are the anterior portions. They are anterior. The rough parts of the atria, whether it's the right atrium or the left atrium, will be at the anterior portion, ventrally. While, of course, the smooth portions will be posterior, the dorsal aspect. I want you to understand this. And that is why it makes sense that I told you that the pulmonary veins, the four pulmonary veins, will be opening into what we call the posterior aspect of the left atrium. Yes, I want you to appreciate that. So if I look at this right atrium, we want to appreciate it. Now also remember that whenever we talk about the rough anterior portions, okay, I've told you that rough anterior portion will be coming from primitive atrium. that when I talk about the smooth posterior portion, rough anterior, smooth posterior. Okay, the smooth posterior portion, as I told you, from of course the sinus, body of the sinus venosus. Now, that will be during the embryonic development. But post-embryonic development, what is going to happen is that it won't be called, okay, so for instance, we pin the smooth posterior wall. Then we'll give, let's say, give another name for the smooth posterior wall. You don't say that is the same as the body of sinus venosus. You can say that's the embryonic origin. But what you are seeing is not the body of the sinus venosus. The name will change, become sinus veranum. I want you to appreciate that. But the first thing is that quickly telling you that this right atrium will be having what we call the rough, okay, rough parts, okay, where is posterior, sorry, where is anterior, rough anterior portion. Rough is anterior. And then it will also be having what we call smooth. And smooth is nothing but the posterior part. The rough portion, as I told you, for the right atrium, just like for the left, will be coming from what we call primitive atrium. Primitive. While the smooth posterior part portion, unlike that of the left, which will be coming from absorption of the four pulmonary veins, remember, that of the right will be coming from the body. I'm interested in telling you that is the body of sinus venosus. But, okay, what happens is that if I ask you, if I pin this area, for instance, and ask you, and you tell me it's a smooth posterior wall, how about another name? Then you can also call it, aka this guy, also known as sinus veranum. Okay, I appreciate that. Sinus veranum. Enough of that. The question is, what delimits, what separates the smooth posterior wall from the, rough anterior portion? Now, let me also tell you another thing. In the case of the auricles, the ear-like appendages of the atrium, whether it's right or left, will be entirely made up of rough components, rough throughout entirely. And so it means that they also be coming from where? Primitive atrium. Now, the rough portion, the rough anterior portion and the smooth posterior portions will be delimited internally by something called crista terminalis. But on the external aspect, we have something called sulcus terminalis. Let me demonstrate this thing for you to appreciate over here. Now, assuming I have this, let me say I have this to be my superior and inferior vena cava, because at the end I'm going into the right atrium, and you know that the great veins which are draining blood in there will be the superior and inferior vena cava. And then over here, I put the delimiting structure over here, which will be separating the rough component from the smooth component. A delimiting structure, this internally, I've cut to reflect it. So internally. And then from here, we also be having together with this. Let me make it this way. Okay. Now, what I have over here is the one derived from, of course, this primitive atrium, the rough, okay, the rough anterior portion, the rough anterior portion. So this is the rough anterior portion of the right atrium of the heart, and these will have some comb-like, okay, looks like a comb-like muscles. Now, these comb-like muscles are referred to as musculi pectinati. Something we simply call it, if you reflect it in the English language, we call it pectinate muscles. Pectinate muscles, musculi, comb-like muscles. Now, these comb-like muscles, what they can also do is that they help to increase the contractility of the wall of the right atrium of the heart without necessarily increasing the muscle mass. Okay, so that's what they are doing. And they try, and then of course they direct the blood also in this manner. Now, this one over here, I'm trying to show you, this is of course the superior vena cava. Now remember that the veins, because or any vessel, because they are smooth, they will be opening the smooth component. I mean, you understand? So that will be the posterior component. The same way, this is the inferior vena cava that I have over here. Now, one thing is that because the superior vena cava drains blood in favor of gravity, usually it is valveless. But in the case of that of the inferior vena cava, it has to drain blood from lower regions of the body against gravity. Usually there's the valve. And you know the name of that valve? We call it, okay, valve of the inferior vena cava, which also has an eponym. We call Eustachian valve. Okay, so its valve is called what? So that is guarded by the Eustachian. Okay, guarded by the Eustachian valve. Now, in the rough anterior wall, it's as simple as that. The muscular pectinate, there's no problem with that. But in the case of the smooth, okay, smooth posterior wall, there are a lot of features over there. Now, one of them is that we've seen that these vessels will be opening in there. The other thing is that there will also be something which initially in fetal life, there was a connection between the right atrium and of course the left atrium. Okay, yes, what's the name of that, connection? It used to be called foramen, ovale, but postnatally it will change to close off so that there's no connection between them. Some people call fossa ovalis. So this thing I'm trying to show over here is the fossa ovalis. Now, if you've watched the previous videos I've done on the development of the heart, you get to know that the fossa ovalis will have a floor. So that's actually the floor of the fossa ovalis, which is made from what? Septum primum. Some of these things, they are there. Go and find some of these things. And of course, the one where is forming the margin of the floor of this fossa ovalis will be called the limbus of fossa ovalis. Limbus of fossa ovalis, or something you call annulus, forming that kind of ring. So simply, this is my fossa ovalis. I won't talk much about it. Now, the other thing is that what's going to happen is that once I move away from the right atrium, if I go downwards, I'm going to what we call the right ventricle. So there's going to be that kind of atrioventricular orifice by way of the right atrioventricular orifice, okay, over there, and to be guarded by valves. Valves are going to guard these areas. So let me take one of those valves, okay. So let's say over here we have what we call the septal cusp. Okay, so this one you find over here is nothing but the septal cusp of who? The right. We are talking about tricuspid valve. Septal cusp of the tricuspid valve. Important. Now, between the septal cusps, okay, inferior vena cava as my reference point, okay, this region over here, there's another opening. Remember that I told you that the smooth areas, they are where the vessels open. Okay, so the opening or the ostium of what we call another vein, which we call it coronary sinus. Coronary sinus, okay, so over here around this area, so I have the ostium of the coronary sinus. You also find it over there, ostium or the opening of coronary sinus. Okay, you find this over there. And my friend, something else, importantly. Now, please understand this concept. The right atrium, okay, and then the left atrium, there will be something separating them. It's what? It's going to be a septum. And the name of that septum will be called interatrial septum. Yes. Now, once I try going a bit at the lower portion of this interatrial septum, I will see something. Okay, if I go even beyond that, I will see something, and that is something we call atrioventricular bundle of His. It's going to be in there, in the cardiomyocyte over there. But if I come just cranial to it, I will see something we call central tendinous body. Okay, there will be a central tendinous body, and arising from that central tendinous body, we see, because of the the skeleton of this heart wall. Okay, find all these fibrous components over there, fibrous skeleton of the heart. We see that there will be that kind of bridge. Okay, there will be some kind of endocardial bridge. Okay, moving all around like this. Now, this one, as I told you, the origin from the central tendinous body, but I'm just trying to show over here some portion. This is something we call tendon of Todaro. Tendon of Todaro. Is also in, of course, the smooth posterior wall of the right atrium, tendon of Todaro. Now, please appreciate this. Now, it will come, this tendon of Todaro will come all the way till the level of the eustachian valve. It will come and attach over there, but I'm not showing that full extent. So we see that ridge over, that elevation over here in the smooth posterior wall of the right atrium of the heart. We see what we call the tendon of Todaro. Now, arbitrarily, we see that there's a triangular region. Arbitrarily, there's a triangular region, which, let me say, this area, okay, this is the region. There's a triangular region, arbitral triangular region, which is bounded posteriorly by this tendon of Todaro. So I want you to know the boundary, that's this thing I'm trying to show you here, the boundary, the tendon of Todaro will be posterior. Okay? But anteriorly, by this guy over here, which we are calling the septal cuffs. Okay, so the septal cuffs of the tricuspid valve will be the anterior boundary of this triangle I'm trying to show you. And then, of course, the ostium of the coronary sinus will be at the lowermost portion, will be at the inferior boundary of this triangular area. This triangular area I'm trying to show is something we call triangle of Koch. We call this guy triangle of Koch. So that's the eponym, triangle of Koch. Now, why is the triangle of Koch important that we identify? For the reason that is where the cardiothoracic surgeon, when it's performing any surgery on the heart and wants to locate the atrioventricular node, that's where he'll be going to. So we want to arbitrarily identify the triangle, locates. So the location, so the triangle of Koch is nothing, but it is the location. I want you to know that. The location of, let me bring it over here. The triangle of Koch is the location of the atrioventricular node. Of course, the AV node. Okay, and you know that is first part of the conduction system of the heart. First part of the conduction system of the heart. That's what I want you to know. Okay, so importantly, these are some significant features I want you to become aware as far as whenever you open the right atrium of the heart, you are going to appreciate some of these things. Now, quickly, if you want to move on, then we talk about the last one for the day. And that is going to be, now before I even move on to tell you, now I told you that that's the delimiting structure which separates the rough anterior portion, okay, from the smooth posterior portion. Now this separation, okay, this thing which separates them, okay, the connection internally is something we call cresta terminalis or terminal crest. Now those to the internal aspect. How about to the external aspect? Now, if you come outside, you see that the same cresta terminalis, okay, will show us some feature that was present is present inside, and something we call sulcus terminalis. Externally, we call it sulcus terminalis or terminal sulcus. Okay, so that is something that I want you to become aware of. Now, another thing that I have to talk about. Now, I mentioned one of the conduction systems of the heart that we can appreciate it over here, and that is the AV node, atrioventricular node. Say located in the triangle of Koch, which arbitrarily we find it between the tendon of Tudaro and endocardial ridge elevation that we find over here from the central tendinous body all the way to the eustachian tube. It's eustachian valve. That is the valve of the inferior vena cava. And then of course the septal cuffs, and then also that of the opening of the coronary sinus. You find it over there. Now, how about the pacemaker? Which node has the pacemaker cells? And you know it already, the heart of hearts, and that is the sinoatrial node. And the sinoatrial node, where is it located? Now, the location of the sinoatrial node, is at the superolateral aspect. At where the superior vena cava opens. So this is the area, especially let me use red to show it to be somewhere here. At the junction, superolaterally, where we have, so if you look at the superior vena cava, very superior portion of it, but laterally to it, precisely at the upper portion of where we have this crista terminalis, that's where we find these, what we call SA node, sinoatrial node, SA node. That's what we find over here. Now, enough of this. Let me quickly take you to the last aspect for today's meeting by way of looking at that of the right ventricle. The right ventricle. Let me make this one snappy. Just like the atria, the ventricles also have smooth parts and rough parts. Yes. Now what happens is that way we don't have anterior and posterior walls. Smooth and yes, that's not what we are talking about. Rather, the rough parts are the inflowing parts, and the smooth parts, they are the outflowing part. So ventricle, whichever ventricle I'm talking about, we have what we call the rough inflowing part, something we also call the trabeculated part of the right of the ventricle. And then we have what we call the smooth outflowing part, or the conus part. Yes, we appreciate that, because what happens is that the smooth outflowing component will be coming, whether it's the left or the right, will be coming from the conus. Now, conus is part of what we call it's actually the middle 1/3 of what we call the bulbous cordis. Conus will be smooth. Now, in the case of the left ventricle, the rough inflowing part, or the trabeculated part, will be coming from something we call primitive left ventricle, will be coming from primitive ventricle. In the case of the right ventricle, yes, it won't be coming from primitive ventricle, but rather it will be coming from something we call the proximal 1/3 portion of the bulbous cordis. I've explained these terms, in my previous videos. Try and understand these terms. And so, what we are going to do is that, now, another point. Unlike the left ventricle, where the smooth and rough part do not have a physical separation, in the case of the right ventricle, there's something we call supraventricular crest, separating the rough and then the smooth portions. Just like we saw the cresta terminalis, in the case of the right atrium, separating, of course, the smooth posterior wall from the rough anterior wall. But in the case of the left atrium, there's no physical something like that. Like cresta terminalis, in the case of the left atrium, we don't have it. So it's like the left ones lack delimiting structures. That's what I want you to know. But the right ones will have something separating these components. Now, just to make things so easy for you, I'm going to use a diagram to demonstrate that one, to that effect. Okay. Now let's say I have this. Let's say that we are in the chamber of what we call the right ventricle. We are in the chamber of the right ventricle. Let me just say that. Okay. Now what you see is that, now remember, look at something. I said we have rough inflowing parts. Okay. So let me take it that this is the connection which will be separating the smooth. Okay, so let me make it like this, so that this portion becomes the rough, okay, inflowing, rough, yes, inflowing parts. And then this portion, we don't have this rough one that I'm trying to show over here. So this one becomes the smooth. So let me call this one the smooth outflowing part of the heart. And as I said, we also call the conus part. But in the case of the right ventricle, we call it infundibulum. The infundibular part. In the case of the left ventricle, we call it aortic vestibule. Because then from the smooth part, we are going to the ascending aorta, aortic vestibule. But in the case of the right ventricle, we'll be calling it the infundibular part, infundibulum. Now, I said that what is going to, now this is the rough inflowing part, smooth outflowing part. This thing, where you're separating them, is something that we call supraventricular crest. Supraventricular crest. Okay. Now, another thing. Now, this one is the right atrium. Means that from the, this is the right ventricle. So it means from the right atrium, we are going into the right ventricle. And as I told you, there will be that kind of ventricular orifice space over there, which will have to be guarded by a valve. Now let me take it that, yes, so I have this septal valve. Okay, let me say still, I have this valve over here by way of the tricuspid valve, but because tricuspid have three cusps, I'm interested in the septal cups. Okay, so this is, let's say, the septal cusp of the tricuspid valve. Remember that the bicuspid valve will not have a septal, because bicuspid will have only what we call the anterior and then the posterior cusps. Now, one thing is that, as I told you, the rough, please listen, this is the rough let me bring it a bit, rough inflowing part, which I'm saying that we also call it trabeculae. Now these guys over here, we call them trabeculae carni. Now this is also called trabeculated parts. Now, something I've seen is that, based on my observation over the years in the gross anatomy lab, I've seen that In the case of the left ventricle, we have numerous trabeculae carni, which are finer. They are small, so there are a lot of them finer. But in the case of that of the right ventricle, what I've seen is that they are fewer and they are larger. They are more robust compared to that of the left ventricle. Also trying to understand that in the case of the left ventricle, because the blood will be going to of course, the aortic vesicle and eventually to the aorta to be distributed to all part of the body, we need a much smoother, laminar flow of blood. So that is what I think about. Now, this trabeculated part, now the trabeculae carni, yes, I want you to know that we have three kinds. Yes, there are three kinds of effects. We have normal ones, that's the one we find over here by way of the trabeculae carni. Okay, now the first thing that I want you to know is that we have what we call ridges. So the trabeculated part of the heart, the rough portion, it can be in the form of ridges, the ones we see over here. So if I say a ridge, this is how we demonstrate it. Let's say I have the fiber here, it moves to the other side. Okay, this becomes a ridge. This is how the trabeculae carni are. They are in the ridges. They can also be something called bridges. And this is what I mean. So you move from one point to the other, and there's a space captured beneath it. So it's a bridge. And I'll be showing you one bridge over here in no time. Okay? Something called moderator band, I'll show you. And then I will tell you that there's also something called pillars. There are pillars also. And for the pillar, you know pillar more than I do. It's like this. And so pillar, there's one end attached over there, and there's a portion which is free, where something else can attach over there. And pillars are also referred to as something we call the papillary muscles. Pillar, papillary. So pillars can also be referred to as papillary muscles. Papillary. So please appreciate that whenever I talk about pillars, I'm also talking about the so-called papillary muscles we talk about. Now listen. For example, the papillary muscles is a reflection of the number of cuffs separating the atrioventricular, points. So for instance, in the case of the right ventricle, how many papillary muscles we are going to have? Three. Why? Because we have three cuffs of the tricuspid valve. In the case of the left ventricle, we are going to have two papillary muscles. Why? Because there will be only two cuffs over there. So for instance, in the case of the right ventricle, we are going to see that there will be three papillary muscles, namely anterior papillary muscle, we have septal papillary muscle, and then we have what we call posterior papillary muscle. There will be three papillary muscles over there. Now, but remember that the largest papillary muscle is the anterior papillary muscle. Please bear in mind that the largest papillary muscle is the anterior papillary muscle. I want you to appreciate that. Now, for this reason, if there is the septal cuffs, then of course the papillary muscle, for instance, let me put it over here. Let me say there's a papillary muscle here. Remember, I told you they are pillars. Okay, if this is a papillary muscle, then this papillary muscle will have to be called what? Because there's the septal cuffs, it will be called septal papillary muscle. And so, through some cord line, okay, to be connecting with the septal cuffs in this manner. And these cord-like connections between the cuffs of the valve, and of course the corresponding papillary muscle will be called something we call chordae tendineae. Chordae tendineae. Cors tendineae. Chordae tendineae. Now the chordae tendineae are extremely important, because what happens is that now during systole, okay, if blood is moving from, of course, the right atrium, for instance, into the right ventricle, what happens is that the cuffs can shut it down. So to prevent that, the closing of the valves, prematurely, then we have these colithons, okay, the support coming from the corresponding papillary muscles. That's what I want you to know. These are what we call the chordae tendineae, okay, preventing that kind of closure of the cuffs during systole, okay. So that's one thing I want you to do from the case of coming from the right atrium, blood moved from right atrium into the right ventricle. We want to prevent that premature closure. Is that okay? That's why I have these chordae tendineae with the support coming from, of course, the papillary muscles. Good. Now there's one more thing. So we've seen the ridges. They are the papillary muscles we've talked about. They're largely, that's largely what we call the trabeculae carni. Trabeculae carni. Let me put it that way. Trabeculae. The name is trabeculae carni, and that is the normal ridges we find. And then the pillars, example, that's the one we are talking about. That is your papillary muscles. Now, how about the bridges? Now, to talk about the bridge, then I will change this papillary muscle. Yes, although it's supposed to be a septal papillary muscle, I want to make it anterior papillary muscle for now, for the illustration of a concept. We see that there will be let me put it this way. Now, look at it. There's a space beneath it. Okay, this one is something we call septomarginal trabecula. Let me put it well so that you understand it better. This is something we call septomarginal trabecula. It's a bridge because there's a space beneath it. Now we are called the septomarginal. Okay, why? Because coming from what we call, okay, now what is going to be here? If there's the right ventricle, then there's going to be a left ventricle. There will be a septum, interventricular septum. So from the septal region, now remember, from the conduction system of the heart, okay, we have what we call the atrioventricular bundle of His. That's the main trunk. And to divide into two, the left bundle branch and then the right bundle branch. The right bundle branch will have to come all the way to the right side. And to do that, from that septum, okay, the interventricular septum, so from that ridge, there will be that kind of bridge over here, which are called the septomarginal trabecula. Okay, one of those, trabeculae carni, where is a bridge, and to be connected from the septal point, okay, from the septum all the way to the margin of this time around. As I've told you, I've changed it to anterior papillary muscle. Anterior papillary muscle. And this is something we call septomarginal trabeculae. Something we also call moderator band. Moderator. Because already the coronary system will eventually moderate the contractility of the heart. So this is the moderator band, so that it carries the right bundle branch of the bundle of His. Okay, to, of course, the remaining trabeculae, all those guys, okay, in, of course, the muscles in the right ventricle of the heart. Ladies and gentlemen, it has been a tall discussion with you regarding, I began looking at what we call the pericardium, looking at those reflections by way of the pericardial sinuses. Okay, we looked at those things. Okay, the transverse, the oblique sinuses. We looked at the borders of the heart. We looked at the right atrium, what happens in there in the right atrium, the important features that you got to know. And of course, we finished with, of course, what you have to know in the right atrium of the heart. Ladies and gentlemen, I'm very grateful for your time this evening. Have a good night, all of you, and may the good Lord richly bless you. Amen.